cochlear implant, one of the greatest inventions of the 20th century. It's neither a treatment for a disease nor a fix for injury. Instead, it restores a vital sense. It's not just a device. It opens a new world of sound, words, and experiences for a child. While other implants focus on saving or improving life, the cochlear implant provides a new way to live and experience life. The cochlear implant journey begins with a detailed screening process. From the first hearing test to post-operative speech therapy, every step is crucial in ensuring a successful outcome.
This outcome is not one day, it is a long journey and it is a teamwork. Surgeon is involved, good surgeon, management, good hospital, and device, the equipment has to be good. The audiologist who works for it and the rehabilitation therapist who really works throughout and teach them to speak. It's such a great work, we get outcome like this. So it is a miracle and dedication and hard work. These our children are MBBS, IT, CA, and they are blessed by the family and for the family and working for the society.
The benefits of cochlear implants are well known in the ENT field, with experts actively contributing. However, doctors from other fields can also play a key role in raising awareness. By encouraging early action, we can ensure timely intervention for children with hearing loss. Today, millions of parents worldwide are eager to provide this life-changing device to their hearing-impaired, overaged children. Unfortunately, it is next to impossible, as the neuroplasticity of their children's auditory pathways decreases with age.
हियरिंग लॉस का आजकल इलाज है, सारा इलाज है, पर ये तभी फायदा करता है अगर ये छोटी उम्र में ही किया जाए. तो इसमें एक इम्पोर्टेंस रहती है अर्जेंसी की, टाइम की, एंड जो आपके डॉक्टर कहते हैं वो एडवाइस फॉलो करनी चाहिए.